Hi, I'm Scott Capozza. I'm a board certified clinical specialist in oncology physical therapy. I'm the physical therapist for the Smilo Cancer Hospital Adult Survivorship Clinic, and I'm also the physical therapist for the Yale New Haven Hospital Outpatient Services. And it's a pleasure today to be here with you with Survivor Journeys. I've known Dr. Burton for several years now. He's had me come back and speak at Cancer Survivorship 101 for several years now. And so it's always a great opportunity to talk with him and reach out to his incredible network that he has. Obviously, we're doing it a little bit differently this year. So this year, I presented some updated information on exercise guidelines for cancer survivors. And these new guidelines just came out in the fall of 2019. And for those of us that are physical therapists, for those of us that are in oncology rehab, and this is really exciting because the old guidelines that were first set in 2010 were really based upon the general guidelines for health for anybody really, and they were not cancer specific. And so these new guidelines that came out are much more cancer specific, and I'm going to talk about that in a little bit. So again, I'm honored to be back with Dr. Burton and Survivor Journeys. So what I want to start off with is I want to start off with what is the definition of cancer-related fatigue, because it's important to note that cancer-related fatigue that is caused by cancer treatments, is different than other types of fatigue. If we look at the American Cancer Society's definition of cancer-related fatigue, we can see that it's something that's worse than everyday fatigue, and that sleep does not necessarily make this better. Um, and one of the things that the American Cancer Society points out that a lot of times this cancer-related fatigue can be unpredictable. So you could be going about your day going to work or trying to exercise or just trying to play with your kids. Next thing you know, this fatigue just hits you like a tidal wave. So that's how the American Cancer Society defines cancer-related fatigue. If we look at the National Comprehensive Cancer Network's definition of cancer-related fatigue, again, they talk about how that this is not typical fatigue. This is not fatigue that can be taken care of by rest, and that it can interfere with activity and everyday functioning. And it's important to note that cancer-related fatigue is more commonly reported by cancer survivors. It can be as highly recommended or reported rather as up to 70 to 80% of all cancer survivors. And I would even argue that at some point during a cancer survivor's treatment phase, they're experiencing fatigue on some level. So I would even say that the number is probably as high as 100% at one point throughout a cancer survivor's trajectory. And of course, you can imagine that this kind of fatigue can be much more distressing to a cancer survivor, especially for our survivors who say to themselves, or they might be hearing from their family, from their network of friends, you finished treatment 3 months ago, 6 months ago, you should be fine. So why are you still tired now? And so that can become the distressing part, that the survivor is done with their treatment, and yet this fatigue just lasts and goes on for months and months after treatment is over. And so it's interesting to dive into what causes cancer-related fatigue. And it really is the perfect storm of all the different treatments that a cancer patient goes under. And so obviously for somebody who undergoes surgery, that undergoes chemotherapy, that undergoes radiation therapy, those are kind of the big three. Also our patients who might have a stem cell transplant. And it's interesting, we need to also factor into this anybody who has any kind of pre-existing condition. So if you already had diabetes, or if you already had high blood pressure going into a cancer diagnosis, that's going to factor into this as well. And this graphic that I've got up now, this is from the American Physical Therapy Association's Academy of Oncologic Physical Therapy, our oncology section. And I think it gives a really nice pictorial as to how the different body systems become affected by cancer treatments. And again, it really is this perfect storm when the lungs become affected by treatment, when the cardiac muscle becomes affected by treatment, the vascular system, and our skeletal muscle as well. So you put that all together and you can see what's going to cause this chronic cancer-related fatigue. So as I was talking about a minute ago with these new updated guidelines for cancer survivors for exercise, this international think tank of different organizations from around the world, the American Physical Therapy Association, the American Society of Clinical Oncology, physical therapists and researchers from Canada and the United States and Australia and from Europe, they all came together to update these guidelines that were set in 2010. Like I said, those guidelines were based on the general population. They were not cancer specific. With an additional decade of research, these guidelines are a lot more targeted. And that's what's so exciting for us in the rehab world, is that we can now dose our exercise and we can talk to you about the amount of exercise based on what you're telling us, what you're feeling. And so, again, to start off with cancer-related fatigue, the old guidelines said that you should be exercising 150 minutes a week of cardiovascular exercise. And strength training was something that was kind of nice, but it was not strongly recommended at that time. Now, with these new guidelines, we actually can say that being able to exercise 30 minutes a week, 3 times, 30 minutes at a time, is actually enough to help decrease some of the side effects of cancer-related fatigue. However, the new guidelines do factor in strength training as well. And so, especially if we're going to get those muscles stronger, as well as the heart muscles and the pulmonary system, our lungs, then we have to put it all together. So it's going to be a combination of cardiovascular exercise, 30 minutes, 3 times a week, and strength training twice a week. I'd like to take a minute and talk about another phenomenon that is very common in cancer survivors, and it's this idea of fear of recurrence. And those of us that are physical therapists, we're not necessarily trained like our colleagues who are social workers or psychologists, but I see these recommendations to be really fascinating because, again, with an extra decade of research, we can now show that exercise interventions can help with anxiety and depression that our cancer survivors can experience, which leads to or ties into cancer-related fatigue and fear of recurrence. And so it's really interesting for us to be able to see this, because if you come to us, if you as the cancer survivor come to us and say, I'm anxious about the cancer coming back, or I'm anxious about what's going on in the world in general right now, we can say, we want you to exercise. And interestingly, we want you to exercise more than if you're actually experiencing fatigue. We actually want you to do 30 to 60 minutes 3 times a week of cardiovascular exercise. And the research is still not so strong yet as far as the strength training. So that's where we're going to spend more of the time working on the cardiovascular system, doing the cardio exercise rather than the combination of the two like we did for fatigue. And another great graphic that came out of that think tank of international experts on exercise oncology back in the fall, was that they were able to definitively say, with all of the research that's been done now, that exercise helps prevent 7 different types of cancers, as you can see on the screen now. And so, again, this is very, very powerful information that we didn't have even 5 years ago, never mind 10 years ago. So, for us, we can say that from a preventive standpoint, initially, but also preventing a recurrence of cancer, we can take this information and we can say, listen, we know that exercise is going to be good for you because we know it's going to decrease your risk of developing these 7 types of cancers. So the big question then becomes, if I know I'm supposed to exercise, how do I exercise? And so that's the biggest question that I always get, especially in our survivorship clinic, is to be able to take these national guidelines and then to be able to meet you where you are and say, okay, what's going on in your life? Where do you live? What do you like to do? And how are we going to make this work for you? And so the simplest way that we can start an exercise program is to start with a walking program. And you can choose a route that's even indoors. Whether you have a lot of stairs in your house, you can do that, or depending on your floor plan, walking around inside your own house, or walking around someplace that's relatively close to home. I'm going to get to in a few minutes our recommendations for exercise, especially now in the time of COVID-19. And it is a good idea, especially if you are starting off, that you may want to have somebody with you, or at least tell somebody where you're going. Probably carry your phone on you, carry some ID on you, just to be on the safe side. And it's really important to think about your breathing. So when you're exercising, you don't want to be holding your breath. You also don't want your mind to really be wandering too much. You really want to be focused on knowing what your breathing style is, being able to breathe in through your nose and out through your mouth. And one of the biggest things that I will always tell people is, when you're starting a new exercise program, whether it's a walking program or a bike program or running or whatever it may be, whatever you really like to do, I always give you license to go shoe shopping and license to go clothes shopping. Right? What's more exciting than starting an exercise program than if you got a brand new set of clothes on and a brand new pair of shoes? So I'm giving you permission to go out and buy yourself a brand new pair of walking shoes or running shoes. Because if you don't have good walking shoes, you're going to end up with a lot of orthopedic concerns, like ankle issues, shin splints, knee pain. And the last thing you want to do is set yourself back as you're just starting to get some momentum moving forward. And so again, when we talk about pacing yourself when you're starting a walking program, or really any exercise program for that matter, a lot of times people will say, you can use this 0 to 10 scale as to what your exertion is. 1 is nothing at all the way up to 10, which is all out, like a bear is chasing you kind of effort. And so if you're doing that kind of a scale, you want to be somewhere in the 4 to 6 range. So you want to be able to have a short conversation with somebody. You don't want to be able to talk and talk and talk. That's probably not enough exercise, but you don't want to be so winded and so out of breath that you can't get any words out. And so that's what this idea behind the Borg scale is, just to kind of keep them in your mind on a scale of 1 to 10, how much effort am I really giving myself now? And it takes a little bit of practice to figure out, what's your 3 effort, what's your 7 effort, and it could even vary day by day, depending on how much sleep you got the night before, how well hydrated you are that particular day. Did you eat prior to exercising? So those can all factor into what your effort is on that particular day as well. And again, we really want you to start gradually. when we talk about having you exercise 30 minutes 3 times a week, or up to 60 minutes 3 times a week, I don't expect that to happen overnight. This is going to be a gradual process. Again, your body has to acclimate to an exercise program, especially if you've never exercised before, or if you have exercised before, but you had to take time off while you were in the middle of treatment. And I think it's a big point to make sure that I emphasize that don't beat yourself up over this. Even within starting an exercise program, you're going to have some ups and downs. So you'll probably start off at a pretty good pace, but then, again, depending on how you sleep, how you eat, how you hydrate, you might go down just a little bit as far as your performance. So not every day is going to be the same, and that's okay. You have to allow yourself to say, today just wasn't my day. I'm going to go home and I'm going to rehydrate, and I'm going to do something positive for myself, and then I'm going to get right back at it. I'm going to try again tomorrow. And so again, if we're talking about trying to build up to that 30 minutes 3 times a week, start with just 10 to 15 minutes 2 to 3 times a week. And it's important to do that 10 minutes and then give yourself a day to recover. And gradually you build up. So especially if it's easy to say, if you start at the first of the month, you can go through that month and say, week by week, you're going to just incrementally build your walking. If by some chance you have one of these fitness trackers on your watch, or you have it on your phone, that's another great way that you can kind of track your progress to say, okay, this week I was averaging 5,000 steps. My goal for next week is to average 6,000 steps. And so the wearable device or the phone will be able to track all that for you. But if you don't have that, that's not a big deal. Just writing it down in a journal is a great place to do it as well. So again, the most important thing is to try to figure out how to exercise, right? And so again, like I was just talking about, tracking it. So again, whether it's on your phone or on your watch, or putting it in a journal, that sort of thing. Again, being able to exercise, with somebody who's within your immediate group, whatever your cohort is for the time being. But again, if you and even if you do it virtually, even if you say to your friend, all right, we're going to go for our walks, even separately, at 8 o'clock. You better go for your walk at 8 o'clock, because you're going to get a text at 8:30 saying, I just went for my walk. Did you do yours? So your friend can still hold you accountable, even if you're not in the same physical space. In pre-COVID times, a lot of times I would tell people that, when we're talking about setting specific goals, I would have people maybe sign up for like an organized walk or an organized 5K, and some of those have been canceled, unfortunately. Some of them have turned to virtual events. But I like the idea now of trying to find some way of goal setting that might be more a little bit broader, something like an active vacation, as the parks start to reopen again, to be able to say to yourself, by the fall, I want to be able to, to do this hike, in Western Massachusetts, or I want to be able to do, this hike, in the Green Mountains of Vermont, or something like that. Every state has all these great resources as far as, different trail systems and different hiking networks and that sort of thing. There are apps that you can download on your phone. I know some of the organizations like the Audubon, that they have different maps that you can download. So so those can be your goal, to say, by the end of the summer or by the end of the fall, I want to be able to do this particular hike. Because then if you put it on your calendar, it's a lot easier to stay consistent with your exercise if you know you have something coming up. And one of the things that I would always do myself is I know that I have to, if I'm going to exercise, especially if I'm going to exercise after work, that it's easier for me if I change at work and then go for my walk or my run, rather than waiting to get home. Because when I'm home, I have to become I put my dad hat on, and so it becomes really hard to be able to exercise when we've got dinner and showers and story time and that sort of thing, whatever is going on in your house at that particular time. So what I would say for anybody who is back to work, but looking to try to get into an exercise routine is to try to do it on your way home, rather than waiting until you actually get home. And of course, this is something that we're all very, very mindful of right now is how are we going to exercise in the time of COVID-19? If there was ever a time that we needed to be able to exercise for our physical health as well as our mental health, now is definitely the time, with so much that's going on in the world now. And so, but how are we going to be able to do that? And especially for cancer survivors, how are you going to safely exercise in this new world that we're living in right now? So again, I would recommend exercising at home or exercising in your neighborhood. So when I say exercising at home, if you're looking at some videos that of exercises that you can do at home, just kind of set up a little bit of a routine there, you can definitely do that. If you're going to go for walks, I would probably stay within your own neighborhood. I would definitely try to go in the morning when it's a little bit quieter out. For those of you who do want to walk with a friend or do want to exercise with a friend, uh, I may say that yes, you probably should both be wearing masks, especially if you're going to be closer than 6 feet together. But if you can, try to maintain that 6 feet distance while you're exercising and keeping your mask on at the same time. There are different trail networks that are a little bit wider, and so that you can be able to walk on the other side of the trail, and still be able to have a conversation, but keeping your mask on at the same time. One of the things that I would say about the exercise classes that you might find online is to make sure that they're being conducted by specialists in oncology. To make sure that they're being put on by physical therapists or occupational therapists who are certified in oncology physical therapy, or are maybe lymphedema therapists, or yoga instructors who have several hundred hours of experience doing yoga for cancer survivors. There are a lot of different programs that are out there, a lot of different YouTube channels and that sort of thing that are out there now. And so you really do have to do your homework a little bit and kind of look through them and make sure that they are being conducted. And what I would say to you is, if you do some of these classes and you feel like something is too intense for you, it's okay to back off. You don't have to maintain the same intensity that they're doing in the videos there. But one of the biggest questions that I've been getting recently is, is it safe to go back to the gym? Especially for anybody who might have had a gym membership prior to COVID-19, as the gyms are starting to open up again. So what I would say to you is, if you have this gut feeling that you shouldn't go back to the gym, I would say trust your gut. If you feel like you want to go back to the gym, you're the consumer, right? You're paying the membership there. So before you go back, you need to make an educated decision of what's going on. So you need to ask the gym, what are they doing right now to maintain social distancing? Did they actually take the cardio equipment and space it 6 feet apart? Who's in charge of wiping down equipment? Is it the Is it the client, or is it the gym owner's responsibility? What is their policy and procedures for cleaning after each use? Those types of things. So these are all legitimate questions that you can ask because you're the consumer. So I hope that this has been a very helpful session for you guys. And I wanted to just remind you all that any movement is good movement. And so what I would say to you going forward is I want all of us to exercise safely and exercise to the best of our abilities. And whatever exercise you can do is good exercise. Thank you.